Good afternoon, everyone. Welcome to today's webinar, Staying Safe This Summer, Answers for Families. We're very excited to be here, and we have some fantastic panelists today. My name is Bethany. I'm going to be hosting this webinar, and I'm going to ask our panelists to go ahead and say hello and introduce themselves. Ellen, do you want to go first?
Sure, I was just preparing, unmuting myself, talking and look like a fool. I'm Ellen Geminiani. I'm a family medicine physician by training, also did sports medicine fellowship, and I currently work at the Division of Sports Medicine at Boston Children's. I have special interest in figure skaters and dancers and performing arts, sports medicine.
Kristin?
Sure. I'm Kristin Moffitt. I am an infectious diseases physician here at Boston Children's Hospital, and I see patients when they are admitted here at the hospital with infections of full range. I also do a fair amount of research in bacterial infections, and as of the last year and a half, do a fair amount of research as well in COVID-19 in children, particularly development of immune responses.
And last but not least, Erica.
Hi, everyone. I'm Dr. Erica Lee. I'm a psychologist here in our outpatient service in the Department of Psychiatry and Behavioral Sciences. I work with children, teens, and parents on a very wide range of concerns, and especially during COVID, we've been talking a lot about kind of managing stress and anxiety and worry and fear, and also just some of the disappointment and frustration that comes along with not being able to do things the way that we want or that we used to. So excited to be with you all today to see if we can be helpful.
Well, thank you all. And since we only have 30 minutes together, we're going to jump right into things. And we're just going to start a discussion here. General summer safety during COVID-19. So, Kristy, I'm going to let you lead that. And yeah.
Sounds good. Yeah, so I have gotten this question a lot in different sort of media forums and things like that, in terms of how I'm feeling in general about the safety of our children this summer compared to last summer. The question is starting to transition a little bit to my feelings around the oncoming school season, et cetera, but I think we'll stay focused right now on this summer. My thoughts actually this summer are similar to my thoughts about the upcoming school season compared to last, is that in general, I feel much better about the safety of our children this summer than I did last summer. And that really is driven by the availability of vaccines, very effective vaccines, certainly available for our population 12 and older. We'll absolutely be discussing more about our children who are under the age of 12 and therefore not yet eligible for vaccination. We'll be talking too about children who may be eligible for vaccination or adults who may be eligible for vaccination, but may not be expected to have an effective immune response, or for whatever reason may not be eligible for vaccination as well. But I would just say that the availability of effective vaccines that have been relatively broadly accepted and covered, especially in many areas within our state here in Massachusetts, really changes the scope of what this summer can look like for children. I would also add to that what we know and what we have learned over the last year and a half, aside from vaccines, about how to keep our children safe and about how to mitigate the risk of transmission of COVID-19, has come so far. The big takeaways that I would say are that we've learned that transmission of COVID-19 outdoors is really, really minimal, outside of really packed settings where people are crammed in together and kind of stuck in that place for a long time together. Outdoor transmission really is of much less concern than we understood it to be when we were finding ourselves earlier in this pandemic. I would also say we've learned too that what's called fomite transmission, or catching COVID-19 from touching a contaminated surface, is also really not a big driver of infection. So we've been able to back off a lot on recommendations around, deep cleaning. I think most of us have been able to feel comfortable stopping, like deep cleaning our groceries when we come home from the grocery store and things like that. And that's really based on science that has evolved and informed our understanding of how people get this infection. So what does that look like for kids this summer? I am thrilled to see kids being able to go to camps being much more available, camps knowing a lot more about what protocols to have in place to keep kids safe. And a lot of that is including masking still, and including masking certainly for unvaccinated individuals when they're indoors. I think it's a different scenario when campers are able to spend most of their time outside. But and then what does that mean for our kids under the age of 12? I think we are all now very familiar with the CDC guidance to still encourage that unvaccinated individuals wear masks when they're headed indoors, that there are only a handful of scenarios outdoors where masks might still be recommended, and for unvaccinated individuals. And then I would just say too that I'm reminded all the time with COVID, and have been really on a daily basis over the last year, that things change all the time. So we even got an update last night from the CDC, really kind of walking back their mask advice, not really a change from what they originally said about vaccinated people being able to feel relatively safe not wearing a mask when they're indoors. They always had, as part of their guidance, the condition of community-related transmission. And so now, about a month or so after that guidance was released from the CDC, we do see an uptick in a lot of different communities with transmission, largely driven by the Delta variant. So they're not necessarily walking back that recommendation, but kind of layering back in that consideration for masking, even if you're vaccinated, if you live in a community where transmission is meeting certain criteria. So those are my biggest takeaways. I would still say for our unvaccinated children under the age of 12, the best thing we can do to keep them safe is to have as many adults in their lives and older children in their lives vaccinated as possible. We know that children, especially young children, tend to get this infection from the adults in their lives and the adults who they spend a lot of time with. So still encouraging the adults and older children that your children, younger children, spend time with to be vaccinated is important and a big step towards keeping them safe.
Thanks, Christy. Ellen or Erica, do you have anything you'd like to add?
No, I think that's fantastic, especially for the athletes to be able to get back, especially outside, feel safer and not have to breathe through the mask. I just have a question for Erica. Do you have suggestions for parents about how to encourage continued mask wearing, which sounds like is going to be part of school and indoor activities still, even for those of us vaccinated? Any thoughts on how to frame it or encourage it?
It's a great question. It's one of the most common questions that I hear from parents of like, we're just sick of this, right? I mean, I think that's true, not just for kids who don't maybe grasp the sort of full scope of this as adults do, but everyone's kind of sick of the restrictions. It's a really different way to live, but it's obviously very important for keeping us safe. So I always encourage parents to start by just joining your children with where they are, right? Children, teens, like explain to them, like, you feel it, you get it, you're frustrated too, you understand why they're disappointed, why they're sick of it, that they just wish that they didn't have to do this. And while you acknowledge that and you empathize with that, this is a really difficult time. And the best way for all of us together collectively to come out of this as soon as possible is to follow these public health guidelines, right? That it's not going to be like this forever, but the way we get this to end faster is we have to do, what the CDC and our physicians are telling us is best for us to keep us all safe. So, for younger kids, how do we need to do that? Do we need to make it so that it's like, they're being superheroes, and this is an extra layer of protection, giving kids choices where they can. So you can't choose whether or not to wear a mask, especially depending on your family and what rules you want to set around who they're with and when they're wearing masks when you go out in public or when they go to school, depending on the district. But they can choose, which mask they wear. A lot of kids find that certain types of masks feel more comfortable, or they're excited if they're like a certain pattern or they've got a certain superhero on them. So for younger kids, you can do that. And then with older kids, again, and teenagers, it's really difficult, right? So the choice is, maybe you might say as a family, when you're with your friends, we still want you wearing a mask. And I know that's really hard because some of your friends might not be doing that, or their parents might have different rules. But in our family, for us to stay safe, this is what we've decided we're going to do. So you can choose from this list of activities, and you can choose to be with your friends, but you have to do so wearing a mask. So I think it's a matter of sort of acknowledging that there are certain things we do not have control over, many things during COVID, and giving your kids choices where you can, but also setting really firm boundaries around what it is that you're allowing them to do or not do, with, again, the emphasis around the more that we all partner together to stay safe, the faster we will be in a world where hopefully none of us have to wear masks ever again.
Thank you, Erica. Ellen, I am going to toss it to you now to talk a little bit about keeping your kids safe during indoor and outdoor activities.
Okay. So I was given a list of areas or activities to cover. First was sort of general sports, which certainly falls in my wheelhouse, right? I think, as a sports physician, one of the things that I find myself explaining very frequently during the day with patients is that, just because you're active in sports does not automatically make you an athlete, or a well-trained athlete, I should say. Yes, you're participating in sports, but I think it's important to remember that putting kids into multiple activities that are very similar does not allow that overall athleticism to develop. And especially in the 6, 7, 10-year-old age group, they're still building strength, flexibility, agility, and neuromuscular control, how to move their body correctly. And if they get into too much of sport-specific activity early on, I think that leads to more injuries, and then makes transitioning through the growth spurt even more difficult. So I would encourage parents to look at camps, programs that offer a variety of activities, or if it is a sport specific activity, that there's conditioning or strengthening activities, building their athleticism, preparing them better. Because before every season, at the beginning of every season, we see athletes that are injured because they didn't have the right preparation, they weren't given any instructions, and they just kind of went out there and did way too much too quickly. And so that would be one thing as fall season comes up, I would tell parents to watch out for. I think making sure that equipment fits properly, helmets specifically, and for football, for lacrosse, and especially for bicycles. Bike safety is important. And what I think you need to make sure is that your child, as they're learning to ride a bike, is comfortable, the bike fits properly, they're in a safe environment, their attire is such that they can see and be seen. Be careful of the time of day, the environment that you're in. Heat is another thing that you have to take into account. Children are have much more difficulty adapting to hot and humid weather, and so they can get heat illness much more easily. So make sure they take breaks frequently and stay hydrated, especially in the summer. You would think that, being and next to water, of course, it's cooler and all of that, but there's a whole litany of things, of course, we have to be aware of for water safety. Water and water accidents, drownings are among one of the highest risks of childhood in terms of severe injury and death. And so you have to make sure, teach your child to swim as early as you can. Also, at the same time, teach them to float. Okay, you can float and survive in a variety of situations, including like a riptide or something that might get caught in. So I think that's an important skill. As an adult, until they're competent swimmers, you need to be able to grab them at any second. You also need to be observing them. You can't trust, especially a group of children. They're going to get excited. They're not going to pay attention, and things happen during those circumstances. So I encourage careful supervision. They call it a water watcher. So the water watcher kind of becomes the lifeguard kind of thing. You should teach them how to be able to jump in the deep end and come up to the surface, how to get to the edge, be able to move themselves while swimming, as well as then how to get out of the water. And I reference again a riptide, if many of us go to the beach. And I think as a New Englander, I think we've all been taught, or a lot of us have been taught how to do that, but I've had circumstances where people didn't, and actually life was lost because of it. In a riptide, you let the tide take you, or you swim parallel or in the same direction as that riptide is taking you. You cannot fight it. You will not be able to fix it, and you need to impress that upon your children, even if you have to float and let the tide take you until you can safely get to shore. It's usually not like a whole beach, it's a section of a beach that is affected by this. So that can be a life-saving skill that you would have. The other thing that we also talk about, I don't know how my colleagues feel, but trampolines. I know they're a lot of fun and the kids love them, and who doesn't love to bounce up and down? However, they are a source of many different injuries. And, most of us just cringe when we hear of kids on trampolines. The exception to that would be in a controlled environment, say in a gymnastics gym where they're teaching them skills, or, parkour training or something, which is similar to acrobatics type of stuff. I think with the supervision of an adult, I think it's certainly fine. Turning to the home, almost more indoors, we all like to think of our home as like a safe haven, which it is in many respects, but as we all learned as young parents, that oh my gosh, everything can hurt them. But I think the things that we see most commonly cause devastating issues are falls, like downstairs, out of windows. So making sure that those areas are protected, and that depending on your child's skill, they might be able to climb something and get over a gate, or climb furniture to get out a window. There are ways there are devices to block the window from opening far enough for the child to get out. You can't rely on the window screen. It won't hold even a small toddler. So those are important factors. I think also outside in the yard, poisonous plants, like I said, environment, heat in the very hot days of summer, staying well hydrated, insects, bites and things like that. People can have allergies, so you have to pay close attention. It's the days of, I think, turning kids out and just never watching them again are kind of gone until they show up back for the dinner bell. Especially when they're very young. So I think you have to always have, out of the corner of your eye, at least, be able to see what's going on. And if they're real little, you almost have to sit there and supervise them and teach them. They need to learn. No one comes with those innate skills and knowledge. Lawn mowers or other household yard tools can be dangerous and a devastating injury. So, no one should be using a riding lawnmower as a fun toy. Even with adult supervision, there's just so much potential for difficulty. You have to be so extra careful. Keep that equipment locked up when it's not in use, so that they have no access to it. And I think that was all I was it's just sort of a brief, real quick. I'm sure, like I said, I could talk about any of those for 10 minutes, but would entertain questions later.
Erica or Christy, do you have anything you'd like to add?
No, I think that was great. I've long held similar fears of trampolines. I hear you say that. I mean, they're great. They're great exercise, but I've also done a fair amount of time in the emergency department setting as a
yeah. If you're an ER doc or work with orthopedics, you just cringe. Erica, one thing I would want, and maybe you're going to talk about this with your piece, what I've seen, with the pandemic is, a lot of frustration and difficulty. And then, of course, they go back to training too soon or too quickly, and then they get injured. How do you guide them through, that transition of out of pandemic and back into activity? Because they just, you can't just turn them loose. They have to progress. And that's a tough concept for kids and adolescents to grasp.
It's such a great question too, because I remember, when we were finishing the last school year, there were some difficulties with that with some of the kids that I see, because they had a shortened season. Mm-hmm. So it also put all of this pressure and anticipation on, like, well, we only, normally we have 6 months and we only have 3, so we have to make it count, but we haven't been training the same way. So it's always about balance, right? So the things that you and Christy have been saying make a lot of sense, and sort of, just taking your time and saying, okay, where is my body? What am I ready for, right? Let me make sure that I'm keeping in good touch with my coach to kind of assess what my fitness is, what level am I ready to sort of compete? How am I working out? What have I had to modify to do at home, or at school within the limits of what's happening with COVID-19? And also maybe just being flexible about our goals, right? If normally the goal is, I played the full football season and I want to do my best, but now we have a shorter season and there's constraints on how often we can practice, or I have an injury I need to heal with, then we need to adjust our goals. So it doesn't mean you can't have any goals around athletics. We just need to be flexible, and they might need to shift because we're not necessarily working towards the same goal And similar to wearing masks, if the goal is safety, right, then we also want to be physically healthy so that we can recover from any injuries. We can kind of take our time, build our bodies back up, or not get injured in the first place, so we can continue to play sports at our full level whenever we're fully able to during the pandemic.
So we are getting a lot of really good questions. And there are some common themes that I'm seeing here. So to anyone who's watching, I might be consolidating some of your questions because there are some very similar ones here. Something that we're seeing a lot of concerns about travel. Is it safe to fly? What precautions should you take when flying with a child? And yeah, just generally, is that something that is safe to do given the rise in the Delta variant?
Yeah, I'd be happy to start with that one. I think one of the other things that we learned from over the last year from the science as well is that airline flights are actually relatively safe places in terms of being relatively well controlled areas where transmission remains low if certain conditions are in place. And part of that has to do with, health screenings, people not traveling when they're ill, which of course we can't always control for. But the things we can control for are keeping ourselves masked. Airports and flights are still requiring masks for everyone, regardless of vaccine status. And of course, for children, this applies to children over the age of 2 who don't have another reason that makes it difficult for them to tolerate a mask. So transmission in those settings is, as I said, very low. And even those under the age of 2 who are flying and they're too young to wear a mask, they're infants traveling with their parents, etc., doing the best you can to keep surfaces clean, keep your own hands clean, extra hand sanitation. If you're like fixing, a bottle or food or something for a child that young when you are flying, taking extra consideration about your own hygiene and your own mask compliance. Again, having yourself vaccinated and as many adults as your child's going to be around when you are getting to your destination would be helpful as well. And under those circumstances, again, transmission does remain relatively low. I'm always asking people to think about what are you likely going to be wanting to do when you get to your destination. And that may require some adaptation because of where we're at. It may be a bit different depending on the geography and what's going on with community transmission where you're headed, but you may want to be avoiding the beaches that are going to be super, super crowded. There is not concern for COVID transmission via the water. And as I said, being outdoors is a relatively low transmission setting, but those really heavily crowded beaches where you might go to, share a restroom and the restrooms are going to have long lines or the snack bars are going to have long lines and you're going to be in close proximity to people and maybe for a prolonged period of time, even if it's outdoors, maybe avoiding that, maybe a really crowded concert venue or something like that, even if it's outdoors, maybe avoiding that. So preparing your child, if they're old enough to mask, for masking for the duration of being in the airport and flying or being on a train or using other modes of public transportation. And then kind of, if they're old enough, preparing them, I think emotionally as well, for the times when they'd be expected to be wearing a mask when you guys are traveling. And even if you're a vaccinated adult, that may mean a show of solidarity and masking with them when you're headed indoors while you're traveling. And that frankly would even be recommended if you're a vaccinated adult and traveling to a place where community transmission is on the rise. So.
Thank you. And Chrissy, I know you touched on masking for kids that are older than 2. We also have a lot of questions from parents with kids that are under 2. And what is the best way to protect those really little ones who are not yet old enough to wear a mask?
Yeah, so that's tricky on a plane. If you wanted to fly with your under 2-year-old, you have them on a plane. Social distancing is not possible on a plane. Having flown not too long ago, they're really packing flights again. But the air exchanges that happen in planes actually do make them relatively safe environments. So again, what I would recommend is being careful about your own exposures. And being careful about maybe extra hand hygiene for you and other family members who are going to be like maybe helping to feed a small child, things like that. But in settings outside of planes or those sort of enclosed environments like that, doing your best still to socially distance with that under 2-year-old would be important. And it might mean really avoiding crowded indoor spaces with that under 2-year-old if that's able to be done. Planning more outdoor activities with the under 2-year-old if that can safely be done. So those settings for someone too young to be able to safely wear a mask would be pretty safe settings.
Thank you. Ellen, swim lessons. If a child needs to actually do indoor swim lessons, is that safe?
Well, as far as, I mean, I'll ask for Kristin's input on this as well, but you know, the water in an indoor pool is chlorinated, and it's believed that there's not transmission through the water itself. I think the bigger concern would be the environment of the pool area. But if it's not, if you are vaccinated and the other adults that the child is exposed to are vaccinated, I think it's just like, you know, common sense. Feel like how, you know, in your area, if it's a high rate of transmission, maybe now is not the time, or maybe try to find a pool in the summer that does outdoors for the swim lessons. I think as we get further into the fall season, hopefully with more vaccinated individuals, and I would assume or imagine that many of the instructors would be vaccinated. So in that regard, safer. But, you know, it's kind of a risk benefit kind of situation where you want the child to know how to swim to be safe, especially if they're going to be around a pool. So you have to determine what that risk might be. Kristin, what do you think regarding indoor pools?
Yeah, I would agree. I mean, the risk of transmission in the water is really nil. It would really be about the closeness that they might have with other swimmers taking the class or with an instructor. Mm-hmm. So if it's a really small child and it's the kind of swim class where you or a guardian is getting in and you're one-on-one with that child and they've got their floaties and things, you're the person who's going to be closest in contact with that child. If you yourself are vaccinated, obviously people aren't wearing masks when they're getting in the pool. That's a pretty safe environment if you can be relatively distanced from the others who are in the pool. If your child is a bit older and they're going to be getting into the pool and doing lessons with an instructor, I don't think it's unreasonable to ask that facility whether or not their instructors have been vaccinated. I think that right now, with everything going on, is a fair and legitimate question. And I would feel safe, again, depending a bit on what's going on in your community. If you're really at a high level of transmission, you may want to hold out and wait a few weeks until things have plateaued and seem to be headed in the right direction. But otherwise, I think with a vaccinated instructor in a pool that is large enough that people can, for the most part, during their time in the pool, be relatively spaced, I think that's a pretty low risk environment in terms of COVID transmission.
Right, we are almost out of time, which is insane. But we have time for one more question. Erica, this one is for you. Lots of parents are asking about socialization, how to safely do that given vaccine status, masking versus not masking. What are some tips that you can give?
This is a really great question, and again, one I'm hearing from so many parents. I think the number one thing that's important for parents to know is kids are really resilient. So a lot of parents are worried, like, oh my gosh, my child's going to be stunted, you know, depending on how old they are. I mean, socialization is just such a huge part of our culture. And so the idea of my children not being able to be with children live or doing so much virtually or having to stay indoors so much, that feels really strange, right? It wasn't what we had growing up. What is this going to mean? Kids bounce back. The most important thing actually is the cues that they're taking from you all as their parents. So what kids do is they look to parents to create a safe and predictable environment, and also to model for them, what do I do when I'm stressed or I'm having a hard time? So kids really follow your cues. And so that's actually the more important piece, is that even though they're not able to socialize the same way, get the social interaction in where you can in a safe way. Even among your family, it still matters. You're still talking to them, they're still reading, they're still having to manage kind of in social interactions and social cues with you at home. That's going to matter a lot. And the more important thing is helping them kind of cope with this time and modeling for them how you're also taking care of yourselves as parents, because you're working overtime always, but especially during the pandemic. And that's going to go a long way towards helping kids get through this and come out fine on the other side.
Well, thank you all. We are out of time. This went by so fast. But for everyone who's watching, we are recording this and we'll send out a link to the webinar by email. So thank you all, and thank you, Ellen, Erica, and Christy, for your time. This is incredibly helpful.
Take care, everyone.
Thank you. Bye.